Okay, so let's unpack this. We are diving headfirst into quite a stack of sources today, all wrestling with one big topic: artificial intelligence in healthcare. I mean, think about navigating the healthcare system yourself, the hold music, the endless forms, that sort of nagging feeling you might miss something crucial.
Right. It's a maze sometimes.
Exactly.
Yeah.
And AI is showing up as this potential super assistant promising to cut through some of that complexity.
Yeah, it's really about using technology to, well, amplify what humans can do. Could be helping clinicians make faster decisions, or maybe making the patient's own journey through the system smoother, less confusing.
Totally. And for this deep dive, we're not just talking AI in general terms. We're really zeroing in on one specific, pretty fascinating application. Using AI not just to treat illness, but to predict something that seems much softer: patient satisfaction. And even better, identifying who might be at risk of having a poor experience before it actually happens. We've got a mix of sources to guide us here: a book chapter on AI in healthcare, and a couple of really interesting research papers.
That focus is pretty powerful, It signals a shift, moving from just reacting to complaints after they happen,
Right.
to proactively trying to shape a positive experience right from the start.
Getting ahead of the curve. Our sources point to this patient satisfaction prediction as a specific, actionable thing AI can do, especially useful for hospitals looking to, proactively improve their service. The core idea is using AI to understand the patient's journey, almost seeing it through their eyes before they even take every step.
And the first big takeaway, really, from the sources is how AI even starts to listen, you could say, about something as subjective as satisfaction.
Yeah. How does it work?
Well, it's not just waiting for a survey response weeks later. It does it by sifting through all the digital breadcrumbs you leave.
Breadcrumbs.
We're talking about analyzing things like, say, your clicks on the hospital website, interactions with a call center, notes from patient reviews online, and also, importantly, securely and anonymized data points from electronic health records.
So AI isn't just looking at the clinical side. It's piecing together this whole mosaic of the experience.
Exactly. It can map that whole journey from maybe your first search online right through to follow up and pinpoint where things typically seem to go wrong for people.
Finding the friction points.
Precisely. And the real value is finding those potential issues early instead of waiting for, a low satisfaction score later.
Right.
The system might flag patterns suggesting someone's heading for a frustrating experience. That allows the hospital to perhaps intervene.
Okay, that makes sense theoretically.
Yeah.
But can you give us a concrete example from the sources of how this actually plays out?
Sure. Yeah, there was one instance described where a hospital used AI to analyze a whole load of online patient reviews, comments, that kind of thing.
Right.
And they noticed this recurring theme. People were really confused about the pre-appointment instructions.
Oh, I can totally relate to that. That pre-visit anxiety is definitely real.
Yeah.
Where do I park? What do I bring?
Absolutely. So armed with that specific insight, which came from the AI, remember that this seemingly small step was actually a major pain point. They didn't just, make a note of it. They actually redesigned parts of their website, created some clear video guides, and even launched a chatbot specifically to handle those common pre-appointment questions.
Wow. Okay. So they acted on it directly.
They did. And the result wasn't just, happier patients, which they did track, but also a measurable drop in calls to the admin staff about these simple questions. Freed them up.
That's a perfect example of understanding the journey leading to real improvements. And it's not just about directly predicting satisfaction scores, is it? The sources also mention other AI uses that contribute.
Oh, yeah, definitely. Things that aren't explicitly labeled satisfaction prediction, but feed right into it, like optimizing patient flow within the hospital.
Wait times.
Yeah.
The classic frustration.
Exactly. If we connect this to reducing patient frustration, tackling long waits, overcrowding, that's huge. There was an anecdote in the sources describing a hospital using AI to monitor wait times in the emergency department in real time.
And what do they do with that info?
It would send alerts to staff to maybe go check in on patients who'd been waiting an unusually long time. Just that simple human touch, prompted by the AI, apparently helped reduce patient anxiety during what's already a stressful time.
Yeah, just knowing someone's noticed you're still waiting can make a difference. What about making complex medical stuff easier to grasp, like discharge instructions? Those can be overwhelming.
That's another critical point the sources bring up, empowering patients with clear information. They highlight how AI tools, especially those using large language models, LLMs, can take that dense medical jargon you often see in discharge papers and, well, simplify it. Imagine Mrs. Rodriguez leaving the hospital and actually understanding her follow-up plan, her meds, the warning signs to watch for.
That clarity prevents confusion, maybe even prevents readmissions, right?
Yeah.
And makes her feel more confident.
Precisely. Less confusion, fewer callbacks, better adherence, more confidence. And then there's the idea of, say, virtual nursing assistants being available anytime.
Like Mr. Patel getting quick answers about his pain medication late at night, that kind of thing.
Exactly. That offers immediate support, potentially accurate information, reduces the load on human staff, and, crucially, makes the patient feel supported whenever they need it. It's about convenient, reliable answers.
Makes sense.
And personalized patient apps, also mentioned, can help with sticking to care plans and just give patients more control by putting health tracking and info right in their hands. All these things kind of layer together, often driven by AI, smoothing out different parts of the journey.
Okay, so the potential for AI to smooth the path, maybe even predict some bumps, seems pretty clear. But what about the patients themselves? You know, the people actually in this system. What do they think about all this tech? Our sources included a qualitative study that specifically asked them.
Yeah, and what's really fascinating there is the mix. It's a blend of real optimism and some significant concerns.
Okay.
Patients in the study generally saw AI as holding great promise, especially for things like improving diagnostic accuracy, maybe getting more personalized treatment plans, and just making the whole system run more efficiently. They get that potential for better care.
And they like the parts that gave them more control too, right? Like using health apps.
Right. The study noted that using apps for self-care made them feel more empowered, more in control of their own health.
There's always a but.
But
yeah.
The study also uncovered some very real, significant worries. Near the top of that list was privacy.
Unsurprisingly.
How is their incredibly sensitive health data being handled? Is it truly anonymous? Is it secure? There's, an inherent vulnerability in sharing that stuff.
Yeah, you can see why that's front of mind.
Yeah.
And what else? Trust in the AI itself.
That too. Can they really rely on a non-human system to be accurate, to be reliable, when it involves something as critical as their health? That trust is absolutely crucial for patient acceptance. If you don't trust the tool,
you won't use it, or you'll second guess it.
Exactly. And the study also highlighted worries about accessibility, equity. Will these advanced AI tools only be for people in certain areas or those who can afford certain tech? Someone literally said, not everyone can access these fancy AI tools.
That fear of a digital divide creeping into healthcare access, that's a really important point the sources raise.
Definitely.
It sounds like from that study, patients don't just want to be passive recipients.
Yeah.
They want a say in how these systems are built and used.
Very much so. They want to be engaged in the process itself. Which leads nicely into the next point.
The complexities.
Right. Building on those patient concerns, predicting something as nuanced, as deeply human as satisfaction with AI, it's exciting, sure, but it comes with some major technical and ethical challenges. It goes way beyond just writing clever code.
So things like data privacy aren't just optional extras.
Oh, absolutely fundamental requirements. The sources really hammer this home, especially dealing with patient data, which is about as sensitive as it gets. In places like India, for example, as the sources mention, this means strict compliance with laws like their Information Technology Act, the Digital Personal Data Protection Act.
So concrete legal frameworks.
Yes, and implementing really robust technical measures, strong encryption, strict access controls, making sure data is properly anonymized. These are non-negotiables, really, for protecting patients and building that crucial trust.
Okay, privacy and security, number one. What else? You mentioned ethical challenges.
Well, there's the huge issue of algorithmic bias. Machine learning models are powerful, but they learn from the data you feed them.
Garbage in, garbage out.
Kinda. If the data used to train an AI, even for something like predicting satisfaction, isn't truly representative of all the different kinds of patients a hospital sees, then the AI's predictions could end up being unfair or inaccurate for certain groups.
So the AI could actually potentially perpetuate or even amplify existing inequalities in healthcare, just because the data didn't capture everyone's experience properly.
Exactly. If the data itself is skewed, the predictions will be skewed. And a related challenge the sources bring up is the lack of standardized benchmarks. How do we really validate these AI models in healthcare?
How do we prove that an AI predicting satisfaction is genuinely accurate and reliable across different hospitals, different groups of patients, over time?
Right. It's not like predicting, say, a clinical outcome where you have a clear biological marker to test against.
Satisfaction is messy, subjective.
It is. And the sources caution that just relying on AI outcomes that haven't been rigorously evaluated against some kind of gold standard, even if that standard is hard to define for satisfaction, well, it can be misleading. We need really robust validation processes specifically for these kinds of AI tools.
Makes sense. We need to know they actually work and work fairly.
And ultimately, even the most sophisticated AI tools, they're intended to be aids, assistants.
They shouldn't be replacing the human element.
Not at all. Human oversight remains absolutely essential. AI should ideally augment medical judgment, maybe streamline processes, provide information, but it cannot and really should not replace the empathy, the communication, the personal connection between a patient and their care team.
That human touch is so core to the patient experience itself.
Fundamental. You can't automate empathy.
So, okay, let's try and bring this all together. What does it all mean? AI clearly holds, tremendous promise to proactively improve patient satisfaction. You can listen to data in new ways, spot potential problems before they blow up, streamline frustrating processes like appointments or understanding discharge info, and empower patients with tools like apps and virtual assistants.
Realizing that vision isn't just a tech problem, is it? It demands incredibly careful attention to protecting that sensitive patient data.
Right.
Making sure the AI is fair and unbiased for everyone, and really rigorously validating that these tools actually work as intended out there in the real world, not just in a lab.
And crucially, it seems, it requires keeping the patient's voice, their concerns, their need for privacy, their desire for trust, their fear of being left behind, keeping that right at the heart of how these systems are designed and rolled out.
It's about building trust right alongside building the technology itself. They have to go hand in hand.
Which leaves us with a pretty big question, doesn't it? Can AI truly capture and predict something as profoundly human, as nuanced, as feeling satisfied with your care? And maybe more importantly, in this rush towards efficiency and predictive power, how do we make absolutely sure that the heart of healthcare, the patient's actual lived experience, is genuinely enhanced and protected for every single person, without exception? That's definitely something we're sitting with.